Hi, today we're going to demonstrate an OR room setup.
In this video, we will demonstrate the following.
How to set up standard monitors at the head of the bed.
How to perform an abbreviated machine check.
Suggest a basic airway setup.
Suggest a basic OR drug setup.
And lastly, IV fluids.
Standard monitor setup. Place the EKG monitor with stickers on the bed, the black, brown, and red leads on the left, white and green on the right. Place a head cushion, taking care not to position the EKG hub in the center, as this can cause pressure injuries. Place a head strap on the pillow to aid during difficult mask ventilation. Do not place a blue towel on the head pillow, as this is wasteful. Position the face mask with gas sampling line and anesthesia circuit to the right, either on the so-called Christmas tree or on the arm of the machine. Place the pulse oximeter cable with probe on the side of the anticipated peripheral IV. Place the blood pressure cable on the side opposite the peripheral IV if conditions allow. The patient will have the actual blood pressure cuff with them. Note, the patient may also already have a pulse oximeter probe and EKG stickers on them. If so, place the new supplies on the clean workspace and save for later use to prevent waste. Abbreviated machine check. Disconnect the circuit from the face mask. Dial the adjustable pressure limiting valve, or APL, valve past 30 centimeters of water. Occlude the circuit. Push the O2 flush valve until the bag expands and listen and feel for any leaks in the circuit or bag. The high pressure alarm should sound. Next, disconnect the bag from the arm and attach it to the circuit. Dial the O2 flows up and then switch the vent on. Make sure the bellows fully rise and fall. Make sure there's enough oxygen pressure from the main source and the O2 tank. In older models, shown here, check that there's enough oxygen pressure from the main source and the O2 tank on the gauges. This may not tell if the source is disconnected, however. The full machine check will reveal this. Next, disconnect and blow into the gas sampling line and check for end-tidal CO2. Then, reattach the sampling line. Check that your suction setup is complete with canister, tubing, and Yankauer tip, and that it's working. Make certain the tip is readily available near the head of the bed. Basic airway setup. With the basic airway setup, make sure to have a laryngoscope handle and 2 different blades on the workstation, such as a Mac 3 and Mac 4. Open one blade, typically a Mac 3. Check to make sure the light source and the bulb are working. Have 2 different size oral airways and nasal trumpets available. Have 2 different size endotracheal tubes, such as a 7 and an 8. Open and stylet one endotracheal tube, typically a 7 for a woman or an 8 for a man. Inflate the cuff with a 10 cc syringe and check for leaks. Check that the volatile anesthetic vaporizers are nearly full. After reviewing the patient record and interviewing the patient, open the appropriate sized supplies. Keep the rest of your basic supplies unopened, but immediately available on the workstation to prevent waste. Make sure to keep your clean supplies and dirty supplies separated to prevent cross-contamination and infection. Avoid placing dirty supplies directly on the workstation, also to prevent infection. Additional basic supplies. Additional basic supplies include a gastric tube, simple white esophageal temp probe, and an airway humidifier. Note, only some cases require gastric suctioning. Temperature monitoring and airway humidifier are indicated for cases when clinically significant changes in body temperature are intended, anticipated, or suspected. Only use these devices if they are clinically indicated and will affect the treatment plan. Have pink tube and porous eye tape available and 2 pieces ready to go. Note, do not use sterile tegaderm dressings as eye tape or for routine tape. Reserve them for when a sterile dressing is required, such as a puncture site. Sometimes a gauze bite block is indicated. Scissors are always helpful. Emergency airway supplies. Emergency airway supplies are critical for patient safety. In addition to the laryngoscope handle and MAC 3 and 4 tongue blades on your workstation, make sure there is a backup handle and also Miller 2 and Miller 3 blades in the Pyxis drawer for emergencies. Laryngeal mask airways, or LMAs, may be used when ventilation becomes difficult. LMAs are kept in the machine drawer in adult sizes 3, 4, and 5. For routine use, a classic LMA will do in most cases. The Supreme LMA has the gastric suction port and should be reserved for patients requiring gastric suctioning or if the classic LMA does not fit or is unavailable. The Ambu bag is self-inflating and is kept with the bougie on the back of the anesthesia machine. The percutaneous tracheotomy kit is in the Pyxis. Know where your jet ventilator is located. IV fluids. The most basic setup involves a bag of fluids such as a liter of lactated ringers, macro IV tubing 10 drips per ml, and extension tubing with stopcocks. For cases with larger fluid requirements, the Y tubing is helpful. It includes a ball pump to squeeze fluid or drugs for more rapid administration, and also a microfilter that is useful for blood products. A fluid warmer is often added and can be used with either the simple tubing or Y tubing. Simply place the cartridge between the main tubing and the stopcock extension. For safety, it is important to label the IV tubing and the bag with the date and time of the setup, and include any additional medications if added. General OR drugs. These are routine general OR drugs. It is essential to predict case requirements and only open what is essential to prevent waste. A simple mnemonic that some find helpful for the general OR setup is called MAIDs. Monitors, suction, machine, airway, IV, drugs, seat. MAIDs, and you're ready to go.
Thanks for joining us.